Penile cancer is really one of the most challenging patients that men can face. Many men are very, very scared to go to a physician when they feel like they have some sort of a lesion or a mass or a growth that they see on their penis. And there's a lot of fear and maybe even embarrassment about this diagnosis. And so it's very important that if men see a sore that's not healing, or if they notice a lump or bump on their penis, or even in their groin area, that they see a physician and a urologist really quickly. Unfortunately, penile cancer is one of the more aggressive forms of cancer. And so the earlier that we catch this, the better. And the more likely we are to be able to perform surgeries or use medications that don't require us to perform radical surgery on the penis.
Penile cancer could be a serious tumor because many times we will need to remove part of the penis or do a completely removal of the penis. And additional to that, according to the aggressiveness of the cancer, we may need to go and do the lymph node dissection in the groin. We do endoscopically, and has evidence that it's oncologically equivalent to the open approach with less complications because this procedure will be endoscopic with only 3 small holes. We have described and we standardize the technique how to do this dissection without doing the open incision. And obviously the patient has less sequelas of the dissection, less lymphedema, and less skin complications. Important here is that if you see any wart, any bump in your penis, that it doesn't disappear. You go to your primary, you go to the dermatologist, and over time it doesn't disappear. You need to pay attention. They may need to take a biopsy. And the worst part of these symptoms is most of these lesions does not give any pain. Sometimes they just grow, sometimes they get infected, they get odor, but they don't give any symptoms. That's why patients come usually with tumors locally advanced that will require a more aggressive treatment. The take-home message here is: if you see anything when it's small, come to see a urologist and we will take care, and we will try to save the penis, and we'll try to avoid any major resection of the penis.
There's a very important international trial going on right now called the IMPACT trial that we're lucky to be participating in here at USC. And this trial is really important because penile cancer is actually a very rare cancer worldwide. So oftentimes the optimal strategies for patients in terms of sequencing of chemotherapy or radiation or surgery are not well understood. And so we're able to enroll patients in the IMPACT trial and allow them to receive state-of-the-art treatment in a trial setting and allow them to have access to some treatments that they may not otherwise be exposed to.